Hello, good evening, and welcome to the Functional Solution class. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with us we have my co-host, Dr. Esha.
Hey everybody, how's everyone doing? Hey Dr. Tall.
Hey, Dr. Esha, it's good to see you.
Same.
So it is Wednesday evening, and it's the time to talk about some interesting concepts in functional medicine, integrative medicine, and learn a little bit more on strategies or tools, clinical tools that we can utilize to help our patients. And today, Dr. Esha, I'm really excited because we got a really, really interesting topic.
Yeah, I think this is like the first time I've chatted with you about like specifically herbs, and we've chatted about them in relation to other diseases, but I'm really excited. You know, the naturopathic doctors, we love herbal medicine. It's part of our like curriculum training. So it's really cool to see us talking about it tonight.
Yes, absolutely. And that's exactly one of the reasons, major reasons I want you on the podcast today, because you have years of training and also years of clinical experience as a physician using herbal botanical medicine, clinical nutrition, all of that. And also you got years of experience with teaching other practitioners, other providers, and kind of guiding them towards, the functional and integrative approach. So this will be exciting.
Yeah.
I know that my journey into herbology was probably a little bit different when I actually started with the more Eastern approach, the Oriental Chinese medicine approach to herbology. And then I slowly kind of tippy-toed into more of the Western or functional integrative approach, which has essentially the biggest difference is here we focus more on the pharmacology. It's very evidence-based, which is how our community members like to learn it, and also like to. So we're going to talk about today about. Of course, we're going to keep it very clinical, but I'm just going to say it out there. There's a science that we're going to talk about and the clinical application of using herbs, but there's also the art. Herbology is also a form of art, and the more you learn about it, the more you utilize it, you're going to get better and better results. I'm just speaking from like 20 years of applying these methods. And Dr. Esha has years of experience as well. It's kind of like you got to learn the principles properly, but then applying it is where the art comes in.
Yeah,
right?
There's so much to botanical medicine. I mean, you have the clinical application, then you have like energetic applications of botanical medicine. You have make sure you're using the right parts of the plant and focusing on those parts. And you mentioned Chinese medicine. Like I had an elective in school of just Chinese herbs. And I was just so fascinated by the broad amount of just Eastern herbs that we'd never learn in Western kind of functional culture. So I'm excited to talk about the herbs we're chatting about tonight, but just wanted to give a nod to that because you did mention that.
Yeah, absolutely. Of course, we're going to keep it very clinically straightforward. We're going to talk about how it works. It's always important to know when you talk to a patient about a certain supplement, it's really important to make sure that we understand the pharmacodynamics, how it works. There's also a lot of really cool studies that when I first started that was in early 2000, those studies were not available. Today we get a lot of really cool studies. We're going to talk about some of those studies that came out. What I want all of you to get from today's class is we picked the 4 top herbs that can help based on the most common chronic conditions that patients come to see you in a primary care setting. So what I want you to get out of today's class is just one specific herb for a specific common condition that your patients are experiencing or complaining about. And if you just do that, then we already know that we have done our part in providing you with more tools and more strategies that you can start helping your patients, right? So there's obviously there's a few reasons why any medical primary care practitioner, a nurse, a pharmacist, right, or other healthcare professionals we believe needs to understand have at least foundational understanding of nutritional and botanical medicine. Reason number one, your patients are already using supplements. There's multiple surveys that are showing that over 70% of adults in the US are taking some sort of vitamins, minerals, herbal products, and especially chronic patients. There's one specific survey that showed that chronic patients are much more likely to seek out different supplements. And that's because a lot of them are still struggling, right? So if the biggest problem is that if you don't provide them with the recommendations, the evidence-based, educated recommendations, how do they get their supplements, right? So, and that's something that I'm sure, Dr. Esha, you've seen, right? If you ask patients like, well, why made you take these supplements, right?
Oh yeah, it's just like all over the place a lot of the times, kind of why. And it's our duty as functional practitioners to help educate them on what's necessary, what may not be necessary, what may be conflicting, or may not necessarily be beneficial for their condition. So every patient that I've seen, I feel like I would say 90% of them have come to me already taking supplements or botanicals or trying their own things, even if they're like teas, you know what I mean? Those are still kind of aqueous water infusion. So teas, or they've tried botanical medicine in some capacity.
Absolutely. Absolutely. It's interesting that, and this is why we always, have this discussion with medical professionals, is that you don't have to recommend to your patients, nutritional or herbal supplements. They're already taking it.
Exactly.
Majority of it are already taking it.
Exactly.
The question is, are they taking what they should be taking? Right. And interestingly, what we found is that through really asking a lot of patients or through different surveys that we found online, is that if you as their provider do not have that discussion with them, they'll typically rely on Dr. Google or influencers online that are selling them different things, or Amazon reviews, or whatever claims they see on a label, which unfortunately a lot of it is misleading. We've seen that before. And that's so, which means that most of them are not doing it correctly. They're not using it correctly, right? Ineffective dosage to poor quality product or unsafe combinations. And so that's really why the number one reason we always say practitioners should have some fundamental understanding of what works and what doesn't. And interesting, I read this this article about the German physicians, and there was a survey about how many physicians in Germany actually recommend, as part of like the first line of therapy, right? How many of them recommend herbal medicine? And it was close to 60%.
Wow.
So it was really incredible to see that that many physicians in Germany are actually looking for more treatment options for their patients that might not include just pharmaceuticals.
Right.
The whole concept is what we're going to talk about today is like, what else can we offer our patients that would support them? Which kind of lead me to reason number two, right? Medications often don't resolve the underlying mechanism. That's another reason why patients continue to struggle, right? So for example, they take ibuprofen, that didn't work well for them. They go online, chronic pain. Oh, they found this particular supplement or something, and they're trying it, right? Also, one thing to mention is that, and Dr. Esha, you probably had similar experience, right, in years in practice, is that some patients struggle with the complications of medications.
Yeah. Yep. All the
Right?
time. All the time.
Yeah, yeah. And so if your patients are struggling with if they develop either complications or they develop side effects, they are, at least from my experience, they're more likely to seek out other natural solutions.
Mm-hmm.
And the classical example is if you prescribe statins, there's always the risk of muscle aches, digestive discomfort, metformin. 1 out of 3 patients that are taking metformin will have some sort of digestion problems. Diuretics, right? Calcium channel blockers can cause leg swelling or cramps or fatigue, right? So those are often seen with patients. And while medications are essential, right, we're not rushing to replace the patient's medication, but it's, one, doesn't address the root cause, which that's where we have functional medicine. And second, we have to look at the concerns that we have about developing the side effects from the medication. So this is why reason number 3, essentially, and the last one, is many patients are looking for more safe, natural, and clinical supported options that goes beyond prescriptions. And the proof of that is that they pay out of pocket for those products, right? They're not looking for insurance coverage. They go to the stores. And you can look at any store, any convenience store, any large food store, right? Not just the pharmacy or CVS, like any large food store, not just the organic foods. For example, here in Oregon, we got Fred Meyer's. They have 2 aisles, huge aisles, very long aisles, just for supplements. And they got, supplements for a cold, and supplements for pain, and supplements for this, and supplements for that. And so a lot of patients are looking for this. We prefer that you will have, as a practitioner, will have more treatment options, and whenever appropriate, you can recommend them the right either nutritional and herbal compound. And that's what we're here for today, to give you more of those tools.
Yeah. I mean, I would say that, I was visiting my sister in Wisconsin earlier this month, and we went to one of their health food stores, and it's a little different depending on what state you live in. Like in the Midwest, there's not a ton of options like that, but I was just so shocked to see how many options were available for herbal medicines and different brands, really good brands, and some brands I think are questionable, but herbal medicine supplement world, it's still burgeoning in a sense, but it's something that we definitely need to be educated on, because our patients, like Dr. Tall mentioned, they're taking these things. So let's jump into ashwagandha, which I think we've probably all have heard of at some point, or tried, or know somebody that's using it, or you're curious about ashwagandha. Ashwagandha is, in naturopathic medicine and botanical medicine, considered an adaptogenic botanical. It helps your system adapt, if you will, to stress. So typically ashwagandha is one that we think about for chronic fatigue or stress, anxiety. It has other applications as well, but we'll talk about it in that context tonight. So for ashwagandha, we think about anxiety, chronic fatigue. I mean, I feel like 90% of my patients have chronic fatigue, and most of them also have anxiety of some sort. Okay, so according to the National Institute of Mental Health, 1 out of every 5 adults in the U.S. experiences an anxiety disorder in a given year, and nearly 1/3 will experience an anxiety disorder at some point in their lives, which is a significant amount. Chronic fatigue is also incredibly common. I mean, when I was in school, and even still, we were like writing codes every day, writing the ICD-10 code for chronic fatigue. It's incredibly common. Estimated 3.3 million U.S. adults meet the criteria for chronic fatigue, and many more are going to their primary care offices. A lot of us just kind of have chronic fatigue, and we're not really talking to anyone about it because we don't really know what we can do about it. So it's one of the most common things we see in practice. So when we think about ashwagandha, why does it work? What is it? Ashwagandha, its botanical name is called Withania somnifera. It's a foundational herb in Ayurvedic medicine, known as a regenerative tonic for resilience and vitality. The key active compounds, so the pharmacological active compounds are going to be the withanolides, especially with the ferrin A. These are like tongue twisters, but once you see them over and over, you typically know which plant they're associated with. They're going to influence inflammatory pathways, neuroendocrine function, and possibly HPA axis modulation. So we're going to talk about the HPA axis in a minute. Just a little fun historical fact. The name is actually, it means the smell of a horse in Sanskrit. So it refers to both the scent of the root and the belief that it imparts the strength and stamina of a horse. So with all of that being said, let's take a look at a picture from the Journal of Herbal Medicine published this year on how ashwagandha helps to reduce stress. As you can see, there are multiple points of data on how ashwagandha works. But if we want to just understand the core pharmacodynamics, let's just focus on two major pathways, the GABA system and the HPA, hypothalamic pituitary adrenal axis. And so ashwagandha helps regulate the HPA axis, which is your body's central stress response system, right? So when somebody comes into the office and they have chronic stress, chronic fatigue, we're thinking of many things. So one of the things we should also be thinking is HPA axis, like what is happening with this person's hypothalamus, pituitary, adrenal signaling system. So kind of always keep that in mind. The body's central stress response system, your HPA axis. So studies show ashwagandha can lower elevated cortisol and DHEAS, meaning the HPA isn't firing excessively for your patients. And in simple terms, it just kind of helps to reset the body's stress thermostat. So that's kind of the adaptogenic aspect. It helps your system adapt to the stress response. It also affects the GABA system. So GABA stands for gamma aminobutyric acid, which is basically like a neuroinhibitory transmitter. So it helps to calm things down. So you want to think about GABA systems for your patients who are a little too wiry, anxious, that kind of thing, overstimulated. Ashwagandha appears to enhance GABA activity and receptor function, so helping to regulate overactive neural brain circuits. They're going to drive anxiety and tension. And so by supporting both HPA axis and the GABA tone in the system, ashwagandha can also improve sleep quality, reducing sleep latency, so it's easier to fall asleep, less time falling asleep, and also enhancing deeper stages of non-REM sleep. And then obviously better sleep, you just feel better overall. And then overall, with that being said, ashwagandha acts as an adaptogen, which is kind of what I mentioned earlier, helping to reduce the sympathetic tone, so reducing that fight or flight response, right, which most of us, kind of tend to live in, reducing that sympathetic nervous system response, and then lowering the allostatic load, which basically improves the body's ability to adapt without getting overwhelmed. So ashwagandha is a really cool kind of standard stress botanical in the world of botanical medicine. And you may want to take a deeper dive. I mean, there's some really cool studies outside of just the stress picture and what ashwagandha can do in the system. So just a clinical trial to think about. In a randomized double-blind placebo-controlled study published in the Indian Journal of Psychological Medicine, this was around 2012, they evaluated the effects of ashwagandha for chronic stress. So it's a prospective, randomized, double-blind, placebo-controlled trial, 64 adults with chronic stress. They took 300 milligrams twice daily of high-concentration ashwagandha extract, so a total of 600 milligrams daily, right, for 60 days. And they measured the perceived stress scale, anxiety scores, and also their serum cortisol, which is really important, a little more objective, if you will. And then in the results, what they found was there was a significant reduction in stress and anxiety scores. Cortisol decreased significantly versus placebo, and adverse effects were mild and similar to placebo. So the big takeaway there that as a clinician that I think about is that cortisol picture being decreased significantly, because how many of our patients are just on overdrive and kind of chronically stressed with life and all the things. So this is a really nice way to help support them with evidence-based botanical medicine. So in conclusion, 600 milligrams of a standard ashwagandha extract for 2 months reduced perceived stress, anxiety, and cortisol in adults with chronic stress. So we're going to share the reference for that. I think it's popped up on the screen there. Maybe that's a different one. Oh, there we go. So that's the reference for the study if you're interested in reading more about that one. So let's do a pop quiz. All right, pop quiz. What primary body system does ashwagandha help regulate? I know you're all going to get this one correct. And the correct answer is yes, it is B, the HPA, hypothalamic pituitary adrenal axis. So there's a question that just popped up, Dr. Tall. It says, does it work on patients with epilepsy? I wouldn't know that off the top of my head. I would say you probably have to see if there's some clinical studies for that one. I've not clinically seen it used for patients with epilepsy. But yeah, what would you say, Dr. Tall?
Yeah, there's so I haven't seen any studies on epilepsy with ashwagandha, but I have seen some really good studies on the ketogenic diet and epilepsy.
Yep.
So, and this is interesting because Dr. Amen, who's the founder of the Amen clinics, and did over 100,000 scans or something like that in patients, brain scans, over the course of his lifetime and career, have always saying that the brain is a big ball of fat between our ears, right? And I just love that saying. And so there's we're not going to get in obviously to the mechanisms of ketogenic diet. We have like a whole specific training in the advanced functional medicine about the different diets and how they work. And I noticed there was one specific training like that in your training that is coming up, the integrative health practitioner. So that's where we dive more. But I would think about omega-3s. I would think about ketogenic diet. I think that is definitely something that could be useful for them. And then there's another question here about patients with often experiencing panic attack and low cortisol due to chronic stress. So obviously ashwagandha, if you get the patient's labs, which is something we go deeper in the functional medicine training, you're going to be able to determine where ashwagandha is more beneficial and where it isn't. There's a way to decrease cortisol. Ashwagandha sometimes work more as a regulator of cortisol secretion. There is a way to support lower cortisol, which might be different. But if they got a panic attack and they got low cortisol, from my experience, it will typically mean that they have some sort of there's either stage 3 or 4 of the subclinical adrenal insufficiency.
Yeah, I think that's a great answer.
Yeah, because physiologically, whenever we experience stress, someone cuts you off, you have too much stress at work, whatever it is, you're going to secrete higher amounts of cortisol. And if you don't, what typically that means is that your body that system has been abused, right? That's in like layman terms. This question about pregnant women and women taking birth control with ashwagandha. Do you want to answer that?
Yeah, I mean, there's not any like studies around ashwagandha in pregnancy. I know like in Ayurvedic medicine and some pregnancy formulations, they do use it, but I don't necessarily know if it's been clinically, I know it's not been clinically studied in pregnant women, or we don't have sufficient data to say if it's safe or not. So I probably would just generally avoid that for the sake of the fetus and just not knowing what the impact could be.
Yep. Absolutely. And there is, so when it comes to birth control, it's less of a concern, but if they're pregnant or breastfeeding, as Dr. Asha mentioned, those herbal compounds could go into, the fetus or the baby. They can impact, have some impact. So we typically tend to avoid, but that's why in our programs, we also teach you nutritional compounds and dietary and lifestyle factor strategies. Then if the patient, you can't use herbs, right, for whatever reason, then you got option B, option C, right? You got other options that you can go into. And And yeah, to answer the last question about ashwagandha and autoimmune conditions, I've heard that before. I've never seen that happen in clinical practice. But yes, if your patient has an autoimmune, then you want to use precaution always. I think that's just a good general
Yeah,
statement. And to be honest with you, if somebody comes in with an autoimmune condition such as rheumatoid arthritis, ashwagandha would probably not be my first
exactly.
first
Yeah.
one. But that's exactly what we're going into this the second top herb that you want to know for your patient. So thank you for asking that. That's a perfect transition to our next herb, which is more specifically for chronic inflammation, chronic pain. So we can definitely go into that. So so the next one we're going to talk about is ginger. And the reason we pick ginger is because chronic pain is so prevalent. The surveys are now talking about nearly 1 in 4 adult Americans are impacted by chronic pain that interferes with their daily function. So obviously, it's really important to know what can we offer them. Now, we previously talked about curcumin and some other herbs, but here we want to talk about a herb that there's a lot of clinical studies. It's underutilized, and most practitioners don't even know about the impact of this herb for chronic inflammation, and that is ginger.
Mhm.
So ginger is really interested. It became famous traditionally for reducing nausea. But ginger is actually one of the most powerful herbs or botanicals we have for inhibiting some inflammatory pathways. So it's rich in phenolic compounds such as 6-gingerol and 6-shuganol and zingerone and all and additional other weird names that I can probably not probably take me a few minutes to try to pronounce. But a fun historical fact is that in medieval Europe, ginger was so valuable that a pound of ginger sometimes cost the same as a sheep.
What?
So,
So strange.
yes, yes. So I don't know if it will work. It's the same ratio today. So if if you want a pound of ginger, you'll have to get a sheep. But it's just fun to know that we're thinking about medieval Europe, where they used to exchange. You go to market, and I'll give you eggs, and you give me milk, and we just
Yeah.
trade. So that's how they trade. A pound of
Yeah.
ginger. If you want a pound of ginger, give me a sheep. If you want half a pound of ginger, I don't know what you do in that case, right? But
Yeah, good luck with this pound of ginger today in America. You're not going to get anything.
exactly. So it was very valuable. So let's take a look at some really cool study on how ginger reduces pain. And of course, since we are always looking at the medical herbology, we really want to understand more of the pharmacodynamics and how it works. So let's take a look at the picture from the journal Molecules. This was published in 2022. And you can see that on purpose, half of your illustration on the screen, the researchers have kind of slightly blurred it or kind of blanked it a little bit, right? They put like a white cover on top of it. And that's because, as you can see, ginger on the top right, and you can see these 2 arrows going to the left and to the bottom, and you see this stop sign. And that's exactly where this is like the entire inflammatory cascade. And they wanted to show you where ginger blocks or inhibits certain enzymes that can lead to that. So let's talk about this, because it's really interesting. And I love this visual. It makes it a lot easier to understand how it works. So ginger's bioactive compounds interrupts essentially the arachidonic acid cascade, which is, starts from the top and then slowly escalates downwards by inhibiting key enzymes. So you can see here COX-2 is inhibited and lipoxygenase is inhibited, which normally drive the production of pro-inflammatory prostaglandins and leukotrienes. And this is really sort of in simplified words, right, the way in which, or the pathway in which the phospholipids, right, the phospholipids from the cell membrane lipids, right, they go in and mostly we're talking about arachidonic acid, and they initiate this pro-inflammatory cascade or mediators. And one thing additionally to mention is that these compounds in ginger also suppress the activation and transcription factor, nuclear factor kappa B, which is a central regulator of immune and inflammatory gene expression, right? So essentially, when we always ask practitioners, why did your patient have inflammatory conditions or autoimmune condition, they always say it's the patient's genes, right? And so in functional medicine, we dive deeper into understand what actually triggers those. That's the epigenetic, right? We get our genetic at the core, right, at the DNA in a center of our cells, right? Not literally center, but just talking in terms of reference, right? And then all around it, we have everything else that triggers those genes. That's what we refer to epigenetic, right? And that's where we're talking about gut bacteria and environmental factors and what your patient eating and what are their lifestyle, and do they have stress, are they exposed to things, right? All of those different factors. And then we go down all the way down to the level of the cells. So the cool part about ginger is that it down regulates the activation of those genes, which is really essentially how ginger is reducing the inflammation, could be supportive of a patient that have an autoimmune condition, because we are talking about a botanical herb that turns off these inflammatory signals along this inflammatory cascade. And you can see all the bottom. We're not just talking about inflammation. We're talking about like autoimmune conditions such as rheumatoid arthritis and lupus and inflammatory bowel disorders. And the researchers also mentioned cancer. So we're not going to get into it today. We have a specific class with Dr. Boyce. He's been a physician for 38 years, and she created a class for us on the functional oncology, where she explained in much more in depth the causes and triggers and contributing factors to cancer, and some really cool study that she mentions. But just be aware that there's a lot more. When you inhibit these inflammatory pathways, you're helping the patient beyond inflammation and pain, right? So let's talk about how do we use this. So there was a clinical trial. This was a 12 weeks randomized clinical trial published in the Jaundice Sapur Journal of Chronic Disease Care. This was published in 2016. And essentially, they took 90 patients with confirmed radiographic knee osteoarthritis. And they divided them into 45 patients in the ginger group, 45 patients were in the control group. So this was a randomized trial. And the dosage was 500 milligrams twice a day. And again, this was for 12 weeks. And what they looked for are two things. One was the pain score from before and after 12 weeks, and then the satisfaction rate with those patients. And what they found is that the group that took the ginger cap tablets was like 1 gram a day, had significant pain reduction and higher participation satisfaction. And also safety profile was also excellent in comparison to the control, right? So they had better improvement in reduction in pain, higher participation in the group, because they started to feel their results and the reduction in pain. So the researchers concluded that for knee osteoarthritic pain, 1 gram a day of ginger over 12 weeks produced meaningful reduction in pain and improved satisfaction. And the safety profile was excellent. So in comparison to NSAID, which can cause multiple side effects, including GI side effects or complications, her botanical medicine like ginger have a safer profile when used appropriately and could be really helpful for patients. So let's go into a pop quiz now that we understand better the pharmacodynamics of ginger. So what is NF-kappa B main role in the body? And we mentioned that's nuclear factor kappa B, which is, right, we mentioned that. What is the main role of it in the body? 1, regulating blood sugar. B, controlling digestion. C, regulating immune and inflammatory gene expression. And D, producing antioxidants. I'm going to give you a few seconds. So the correct answer is C. So this particular transcription factor, nuclear factor kappa B, is, as we mentioned, play a central role in the regulation of immune and inflammatory gene expression. And ginger is one of those compounds that if your patient is taking it, it can help to inhibit that, as well as COX-2, right? We already talked about that as well. So so far we talked about 2 compounds. We got 2 more compounds that are really, really, really interesting that we want to talk about. The first one, the next two that we're going to go into are going to help especially your patients with digestion problems. And then the fourth one is really important for the winter to have in your toolbox to prevent upper respiratory infections. But I wanted to take a minute and just mention that Dr. Esha has this. If you want to learn more about these specific botanicals or clinical nutrition or nutritional compounds and supplements, really simple, straightforward, very clinically useful strategies you can use to help your patients. We got a new program that is coming out. So let's show the next picture. And that is the Integrative Health Practitioner. And this is essentially a 10-week certification program. So it is very focused on the clinical application, where in comparison to other programs that might have hours and hours, like months of theory or academic studying, right? This program is really focused on clinical nutrition, botanical medicine for chronic diseases. Every week you got a live class that is focused on specific conditions, such as 1 week we do autoimmune conditions, the second week we do cardiovascular condition, the third week we do women's health condition or thyroid, fourth week we do like a hormonal imbalance protocols. So everything is really how to help your patients, and it's very clinically applicable. Of course, we got some awesome bonuses for you guys. That's the phone app. You get treatment protocols for hundreds of conditions immediately. You get access to that from day 1 of the program. You also get a ticket to the Integrative Pediatric Care Summit that is coming up, which is really cool. And then, which we're going to focus more on pediatric conditions and gut health for pediatric, which is a little bit more functional. And then we also introduced a special class by Dr. Scott. Dr. Scott is he's a expert when it comes to integrative blood chemistry analysis. He was one of the major medical and scientific physicians in life extension, and he processed probably hundreds or thousands of different blood chemistry results. And so he created for us a special training on the integrative blood. So when you see your patient's CBC or metabolic profile and things are off, like how can you help your patients to resolve those with clinical nutrition or herbal compounds? So it's a really fascinating study, and we are offering currently scholarships. So if you're interested, check out this page. We'll post the link in the chat to get more information, and you also get a copy of the Integrative and Nutritional Herbal Medicine Clinical Guide from us, which will be shipped to you. We actually send you the printed version so you have it in your practice. So if you're interested, just check it out. It's a really cool program, and we are starting the first week of December. So this is the best time to look into it. So Dr. Esha, let's jump into the herb number 3.
Yeah, do it. This is like one of my favorite herbs of all time. So I'm really so happy that I get to talk about peppermint tonight. I used to use it so much in the gastroenterology practice that I did a residency in after school. Really, really great for digestive problems. And so let's talk about peppermint, the botanical name Mentha piperita, for your gut, your patient's digestive systems. So how common are digestive issues? I see them all day. It's kind of the majority of my practice. But digestive complaints are another massive driver of primary care and GI visits. The National Institutes of Health estimates that 60 to 70 million people in the United States have digestive diseases. And another recent gastroenterology survey found that about 4 out of 10 Americans say bowel symptoms regularly disrupt their life, daily life. So what is peppermint and its active compound? So peppermint is a hybrid of spearmint and watermint. Its therapeutic actions come from the essential oil, rich in menthol, menthone, and then 1,8-cineol. Just a note, when it comes to peppermint and digestive issues, the main action we're going to talk about is the smooth muscle antispasmodic action. And you can't get the same action from drinking peppermint tea, by the way. So it needs to be like a oil, enteric coated capsule, so gut friendly, if you will, capsule of peppermint oil. Okay, so menthol is going to act as a smooth muscle antispasmodic. So it calms down spasming muscles in the gut. It blocks calcium channels. And so it's a key mechanism for IBS symptom relief or patients with kind of just functional abdominal pain. You think about peppermint as a good resource for them. Another fun historical fact for you guys. Peppermint became so popular in the 1700s that it was listed in the London Pharmacopoeia as an official colic remedy. That's a cool fact, not as cool as the ginger for sheep fact, but it's a cool one. How does it work? So let's take a look at a picture from a study published in the Frontiers in Pharmacology in 2020. Here are 3 key ways that peppermint oil appears to reduce pain by several mechanisms, actually. So it's relaxing the smooth muscles of the gut, like we mentioned, mainly blocking those calcium channels that normally trigger muscle contractions. And then when the gut isn't tightening or spasming, the pain signals coming from the digestive tract dramatically reduce. Peppermint also reduces the sensitivity of gut sensory nerves, especially through the cooling sensation receptors like your transient receptor potential melastinin 8, which is a very really long name, but just know that it's going to help reduce how sensitive the gut nerves are. So when these nerves are less reactive, patients feel less cramping, pressure, and discomfort. And then honestly, with a lot of GI patients, they just have so much discomfort and pain for so long that their gut nerves are hypersensitive. And you can take someone who doesn't have GI issues and kind of stimulate them with the trigger. And the patient who has a history of just GI pain disorders, they have a higher reaction to like a stimulant than somebody that does not have chronic GI pain. So their nerves are just kind of hyperreactive. So peppermint helps to kind of calm that down. And then finally, peppermint shows anti-inflammatory effects in the gut, helping to calm immune-driven irritation that can also amplify pain and digestive symptoms. So many ways by which peppermint is a great tool. I would say just clinical pearl from my experience, if your patient has like esophagitis, so an inflamed esophagus, if they have eosinophilic esophagitis, I would be cautious about using peppermint oil because it does relax the lower esophageal sphincter. So if they have already like an irritated or inflamed esophagus or Barrett's esophagus, precancerous esophageal cells, that can actually cause more acid to just kind of pop up into the esophagus and irritate the lining. So that's the only like patient cohort I would just be cautious of using it in, that like the acid reflux patient population in the esophagitis. So an IBS clinical trial, let's like talk through this clinical trial. So a landmark double-blind placebo-controlled trial published in the Journal of Gastroenterology evaluated enteric-coated peppermint oil for IBS. This was 110 IBS patients. They took 1 enteric-coated capsule 3 to 4 times a day before meals for 4 weeks. The results, 79% reported pain relief versus 43% with placebo. And there were significant improvements in bloating, distension, and flatulence, so less gas. Minimal side effects. Mostly heartburn if the capsules were chewed. And so, little pearl for you, another little pearl for IBS, enteric coated peppermint oil, one capsule 3 to 4 times a day significantly reduces abdominal pain and bloating in as little as 4 weeks. And so, IBS, you have to have abdominal pain to categorically be diagnosed with it. So it's a significant, peppermint oil helps with a significant component of that disease or disorder state. So just something to kind of keep in your back pocket. Now, that was so fun to go through. Let's do a pop quiz. Which or what type of muscle does peppermint oil help to relax? A, cardiac muscle. B, skeletal muscle. C, smooth muscle. D, respiratory muscles. And the correct answer, which I know you all are going to get right, is C, the smooth muscle of the gut. So that is peppermint oil. It's really also a really cheap supplement for patients to buy as well. I mean, you can get good quality enteric coated peppermint oil for like $13, $14 a bottle. It's definitely like top of my list for chronic abdominal pain discomfort, especially for IBS patients. So
that's exactly what we like to use when we use integrative medicine, right? It's simple recommendations, simple strategies that are affordable, and they don't require our patients a tremendous investment of time, effort, or money, right? So this is like the easiest strategies that your patient can just utilize right away.
Right.
And that's why the integrative medicine approach in my practice, at least, is something that we used for all patients. Right? Even patients that maybe they were not ready for us to go much deeper into the functional approach and dive into the root causes and do a lot of work there, or maybe order functional labs. But the integrative approach is something that we utilized for everybody, right? And that's exactly why in the advanced functional and nutritional medicine program, we got the functional medicine and we also got the integrative together. And this is, again, why I'm so excited about your class that is starting next month, which is the integrative health practitioner, because these are tools that practitioners can use right away.
I agree.
Even if they only have like 10 minutes per visit, it literally takes like 20 seconds just to make the appropriate recommendation. And they'll get an app. They don't have to remember everything. Dr. Esha is going to teach you the different the different mechanisms, how it works, how to personalize everything. We'll go a lot deeper into the nutrition and lifestyle medicine. But you also have an app and a clinical guide, so everything is there. You can pull it real quick. So that's going to be really cool. So the last herb that we're going to talk about for today is especially important for the winter, where we got lots more colds and upper respiratory infections and challenges, right? So this is a herb that is called Andrographis, and this is a herb that there's some really good studies. Traditionally, has been used for colds, and the reason we're bringing it up right now because it's the best timing, since we know that in the U.S. Adults in the U.S. experience 2 to 3 colds on average, which adds to nearly 1 billion colds annually. So if we all put all our colds together, statistically, that would be kind of weird. But anyway, that would be 1 billion colds, over 1 billion colds annually. So what is this herb, Andrographis, and its active component? So Andrographis is also known as the king of bitters. And while traditionally bitters have been used for helping your digestion, so you know that feeling after a big meal, right? You feel kind of, I had one or two more bites more than what my body could handle. You feel kind of full. Then bitters traditionally in Europe were used and still used to support digestion through different mechanisms. But here it's a king of bitter that was actually found in research to be useful for prevention of upper respiratory infections. And just a fun historical fact is that during the early 20th century. Andrographis plant was used widely in India during the influenza outbreaks and became known as the Indian echinacea. So let's take a look at how it works. We prepared this really neat little picture for you to just kind of summarize really the two simplified pathways on how this helps to improve based on the research. So on the top, you can see on the left, you can see the plant, and on the right, you can see the simplified two mechanisms. One is supporting immune defenses. So andrographolid, which is the main compound in the plant, helps to activate key immune cells. So we're talking about macrophages and natural killer cells, which are really helpful when you get a viral infection, such as the cold, influenza, to enhance the ability of your body to identify and both fight those viral pathogens. And most of the research is really focused on the upper respiratory tract. Now, on the bottom, you can see also that this particular plant decreases inflammatory signals in the respiratory passages, which helps to reduce the irritation in the throat. You know how your throat hurts or irritated when you get a cold or upper respiratory infection, or you got swelling or excessive mucus production. So all of those makes our patients' lives miserable, harder to breathe, and this was reported to provide symptomatic relief, plus supports our immune function. So let's take a look at one particular study that was really interesting. This was a randomized, double-blind, placebo-controlled study, the type of studies we like to have. And they evaluated essentially the extract of the Andrographis plant. And we're going to post the name of the product here. We're not affiliated with any product, but this is what they used in this particular study. So we're going to post it here. It's called Calm Cold, which calm, not with a C, but with a K. So Calm Cold, that's a particular that's a particular name. So you can, if you're looking for where would I find that, that's going to be there. So we just posted it. So Calm Cold. That's where we found this particular plant. And here's the study. 223 adults with uncomplicated upper respiratory tract infections. The dosage was 200 milligrams per day. That's the standard extract. And the duration was just 5 days. So the results in comparison to the placebo, the patients that were taking Calm Cold had significant reduction in throat soreness, in cough, fatigue, and versus placebo. And then symptom severity continued to improve while placebo plateaued. And the overall clinical efficiency was about 2.1 better than the placebo. So the authors concluded that in acute upper respiratory tract infections, 200 milligrams a day of standardized andropragis extract for 5 days significantly reduced sore throat, cough, and fatigue in comparison to placebo. So we're gonna post this conclusion here as well, so you can take notes of that. And we're also going to post the clinical study. So if you want to read more about it, you're welcome to read more. Everything we recommend is evidence-based, that's the appropriate way to practice. So if you see, and this is just a side note, a lot of patients, there's a lot of promotions on echinacea and vitamin C, but just for my own review of those clinical studies and my own experience, I haven't found to be, and that doesn't mean that it doesn't work, but I haven't found echinacea and vitamin C to be as effective as some of those other herbs that we're talking about here. That's one of the main reasons why I don't buy echinacea anymore. but I will buy some of these herbs that have more specific recommendations and evidence behind them. So let's look at our final quiz. And the question is, where does andrograpolid primarily support immune defense? The joints, upper respiratory tract, skin, large intestine. I'll give you guys a few seconds. And the answer is B. So as we mentioned, this entire last section was about upper respiratory tract, and this was the active ingredient that actually was found to stimulate or promote the activity of macrophages and natural killer cells. So now that we have talked about the 4 major herbs that every practitioner knows, and of course there's more. You always want to have in your toolbox at least 1 or 2 herbals for each condition, 1 or 2 nutritional strategies, and maybe 1 or 2 lifestyle strategies, right? That's really important, as we mentioned, because, right, so many patients continue to struggle.
Yeah.
Right? Even though they're taking pharmaceuticals, they're sometimes jumping from one practitioner to the other.
Mm-hmm.
So,
and it's important also, like, know kind of the relative amounts, right? So we talked about doses tonight too, because some patients, they're like, oh, I already tried that, and they're like, it didn't work. And so they're kind of convinced that it's not going to work. If you're like, I think we should do ashwagandha again, or do, peppermint, but they didn't do the right dose of it. And so you have to know, with botanical medicine, you do need sometimes physiologically relevant doses to actually see results. Kind of the same with like pharmaceuticals. You want to see it at a certain kind of effective amount. So just keep that in mind too, like whenever you're thinking about adding botanicals to your kind of toolbox, just make sure you also think about the doses you want to be recommending as well.
Yes, absolutely. And again, we're not recommending that this would be a substitute for medication in any and this is a very general statement. And that's also where I mentioned that there's a science to botanical medicine. It's also an art. So in my practice, in some situation, when the patient comes in and we don't think that it's critical, we will make the recommendation instead of a prescription. And in other cases, we will tell them, listen, go back to your primary care provider. This is going to be important, that we're going to be on top of this condition or symptom, and continue to evaluate or have a prescription. And if we can, we'll definitely give you some dietary recommendations, some lifestyle, so you keep improving your health, right? That's what we're all about. We're all about helping them to feel better, function better. And if we can, sometimes patients come in. We had a lot of patients when we had a diabetes program. A lot of patients came in and they said, I don't like taking metformin. So we said, okay, let's communicate with your primary care providers and see what we can do to make some suggestions here. And with some of them, we had patients within 3 to 6 months when we applied the different strategies, both dietarily, very important with metabolic conditions, and also a few of these nutritional herbal compounds. We had lots of patients within 3 to 6 months, they didn't need metformin anymore. They were well managed without metformin. We've seen that happen before. And so in some specific conditions, you can do that. Now, if somebody comes in and they have, for example, high blood pressure, right? I'm probably not gonna, if it's mild or if it's high, I'm probably gonna involve their primary care practitioner, right? Because it's something that we have to manage. We have to manage as quickly as possible. So that's something that the more, and this is why Dr. Esha, spending some time with Dr. Esha in this particular program, she's starting in December, is so important, because she's literally gonna take you like condition after condition. What are the things you want to look for? What works better? What the research is showing that works better? Give you all the tools and the confidence to really do this properly.
Yeah.
Dr. Esha, you want to take us through the clinician's flow for integrative care?
Yeah. So I would definitely say that I'm really excited to kind of go through the program. And so, when we're thinking about the flow, did you want me to just kind of go through, Dr. Tall, like what we're going to be, the classes, or did you want me to kind of specifically talk about the subject matter?
We can show the picture, and we created this illustration for all of them. It involves functional and integrative medicine, but we kind of wanted to show it for them to better understand how would I help a chronic patient, right?
Got it. Yep. And so obviously, when we're thinking about our patients in functional medicine, we're thinking about the first thing, evaluation. I've had a few coaching calls with a few of you guys already. And so I'm really excited to just hear from more of you. But yes, obviously we're evaluating what they're already doing, right? So what their diet's like, what their lifestyle's like, kind of some of the factors that the environment, their air conditioning, their water factors, mold in the home, things like that you want to kind of be curious about. So all of those things go into the evaluation. Other epigenetic factors we're thinking about, what are they actively exposed to that could be triggering genes and turning things on and off. We want to then educate the patient about these things, right? Explain these root causes. You have, for example, IBS. I see patients who have IBS and they say to me, oh, this was triggered after I had a round of antibiotics or something, my gut's never been the same, or I had some kind of infection, my gut's never been the same. So we want to educate kind of where these root causes could be coming from, and then kind of talk to them about simple lifestyle adjustments, right? So we're providing actionable, clear, kind of concise recommendations. Hey, I want you to focus on these things in your diet, eliminating these foods or adding these foods in, right? Supporting the microbiome with prebiotics, probiotics, if you're like IBS focused. And then we think about specific kind of dietary changes. So sometimes I'll recommend patients, depending on what their diet is, hey, we're going to remove all like processed, ultra processed foods. For most part, everybody kind of gets that recommendation. We're also going to remove for you gluten. We're going to also do maybe more plant-based diet for a little bit of time for you. And then after we kind of get those core principles down, because obviously you have to eat to live, so they need to get the diet in control and figure those things out. And then you think about what else can we layer on. So I'm always thinking of a layering approach. Okay, let's do the diet for a bit. Let's see how you respond. Let's layer on, a supplement. Maybe that looks like we're adding on glutamine for their gut, right? Maybe it looks like doing that for a couple of weeks and seeing how they respond. Maybe then it means layering on a probiotic, right? So that's the kind of flow for integrative care. It's a really in-depth process, and it really helps you to learn a lot about, what your patient's lifestyle looks like. And also, I think it helps as clinicians, us to kind of paint a frame of reference in our mind for how to go forward and deal with just all types of chronic diseases. Even if you're like, I don't really know if I can handle this case, this autoimmune case, but just applying those same functional principles can really give patients a lot of resolve, more than they've actually received just general care. So that's our flow for integrative care.
That's when you look at this illustration from number 3 to 5, which is like, what do I do with a patient right now? My patient is in front of me, they struggle. That's really where the next few weeks with Dr. Esha is going to focus on giving you a lot more of the tools and practical strategies so you can use them right away. Right. Yeah. That's exactly why we opened this unique program, and you get certified as an integrative health practitioner within 10 weeks. So there's case studies. We cover lots of these, I would say most common conditions. So it's going to be really cool. There's a question here about supplement recommendation for complex respiratory issues, COPD-like symptoms. So there are different things. There are different things that that obviously can be helpful. Because we're talking here about chronic inflammatory response, there's what we want to do is first of all, in a functional approach, we would find out what's driving it. Right? That's always the question. Like what's driving that inflammation? What's driving that immune dysregulation? I'll give you an example. I had a patient that it took us a little bit of time, and he was kind of jumping from one practitioner to the other until we used the evaluation form, and they had symptoms and signs and symptoms of mold toxicity. So we did a testing in their home, and they found they had mold spores, higher amounts of mold spores coming from their attic. So once they remediated that, it significantly reduced their symptoms. So it really depends on what's triggering it. And then if we want to do like more integrative approach, there's probably different things that we can do, such as quercetin, right? At this point, we're just trying to manage the condition. Then you would go something more like a histamine inhibitor. That would be the first thing I can think of. Of course, the main reasons why in the functional medicine program you guys have coaching with Dr. Esha, Dr. Kim, and Dr. Chill is because we want to learn more about what's going on with the patient. In the integrative health practitioner, you are going to learn specific treatments, strategies for different conditions such as that. But my initial thought is like, okay, let's inhibit this histamine reaction and in some of the inflammatory pathways as quickly as we can, so we de-escalate the situation and help the patient to feel better, right? Dr. Esha, do you want to add something to it?
Yeah, I mean, I would say ginger that you mentioned tonight also has some cool research around anti-inflammatory aspects for lung health. I would think, there are other botanicals as well. I mean, you could do even inhalation botanicals. You don't really always have to think of like capsules or like tinctures or supplements, things of that nature. Just thinking of lungs and air, you can diffuse botanicals into the air. So I would say things like eucalyptus can be helpful. So yeah, there are tons of different herbs you can use that are really gentle, like lung tonics, if you will, for complex respiratory issues. And I think about other supplements, which I know you didn't ask about, but I would say think about the lungs in the way of what they do, right? So air, so trying to get botanical exposure to the lungs through air or inhalation type of protocols.
Yes, love that recommendation because it's the most straightforward, best probably way to get it straight into the organ, and kind of bypass the digestion tract and all of that. So that would probably be the best way to do that. We'll talk more. Dr. Esha will talk more about like there's different ways and forms of taking herbs, from tinctures to diffusion to there's different ways of using that. If you guys are interested in, we're going to show the picture again of the program. If any of you are interested in joining, this is a 10 weeks program, and we're starting in the first week of December. We're going to take a week off at the end of December for the holiday, but it's 10 weeks, relatively short, really focus on the clinical application. We have a scholarship for it, so we're making it super affordable for all healthcare practitioners. And we'll also include in, because we are promoting this program, we want to give you these bonuses of the phone app, the ticket to the integrative pediatrics care, and of course the clinical guide and all of that stuff. We see this is really one of the most important clinically tools that you can utilize in your practice like right away. So with that being said, Dr. Esha, I really appreciate you being here.
This was like my most fun class. They're all fun, but this one's like so exciting for me tonight. Oh, there was a question we missed. Peppermint for infants colic. So it's something that's been shown to be helpful, but there's, again, it kind of falls into the category of like not enough conclusive data for infants. There are some like infant formulas that are colic formulas. They use peppermint leaf instead of peppermint oil. That might be helpful, but as far as like clinical data, there's not a bunch of that. There are some really small studies showing that it really helps, and it's comparable to, I think it's dimethicone or simethicone, I think, which is like helps to absorb gas in the belly. But I mean, it's something to consider, but you're probably not going to find a lot of formulations for infants with peppermint.
Yeah, and you remember when I mentioned that the reason why we, and not this is another reason why we created this program, is because there's a lot that we always want to have different options for every condition to match. You got somebody coming in, they're pregnant and they got these symptoms. Okay. And they don't want to take drugs, right? What can we offer them, right? Or you got a very young pediatric patients and they're coming in and you're not sure because there's no evidence, in particular, like peppermint, right? There's not enough evidence to support the safety But if you have other tools in your toolbox for, and this is something that then you can make that recommendation and feel more like you're going to be in a safer place for the patient. It's going to be beneficial for them, right? So we're going to pivot to something else. And I'll just give this as an example. For infant colics, peppermint might not be the best choice because, again, as Dr. Aisha mentioned, safety is concerned. And sometimes with pediatrics, with some herbs, we do know what's the appropriate dose. Sometimes we don't. So I would probably pivot, if this was my patient or a family member, I would probably pivot to using something that is very well studied in infants, such as probiotics.
Yep.
And I'll give you one recommendation that has several studies on, and that is VSL number 3. So
I love VSL number 3. Excellent formulation.
Yeah. So VSL number 3 is a specific probiotic formulation that has been studied in infants, and it's very much focused on digestive problems. So I would recommend to looking into that. It's called VSL number 3. And there is formulation that is more geared towards infant. They don't need as much of a high dosage of that. But you can find it in packets, in powder, and then mix it with breast milk, formula. So those can be, typically you'll do like a quarter to half of a full pack per day. But that's exactly why, if you're interested in learning more, join our integrative health practitioner. I would recommend you'll definitely you definitely learn a lot more with that. So you guys had really great questions. I'm so glad that you kind of, you're so engaged. I know it's an awesome topic, and we always want to give our patients the best of the best, right? And so with that being said, join Dr. Esha. She's going to have some live classes. There's other presenters that are teaching in the first week of December. We're going to have some really cool classes with master nutritionist as well, Jessica. We're going to have some really great classes with Dr. Chill. So it's going to be a lot of fun. We got a few presenters in this program, so it's going to be a lot of fun. And Dr. Scott is like a very famous physician in the integrative and functional lab analysis, which I'll be there. We'll have that. So with that being said, I want to thank all of you for being here, for taking the time to develop your clinical skills, for being there every day for your patients. I want to thank Dr. Esha, of course, for taking the time.
Thanks for having me.
Yeah, sharing your experience, what works, what doesn't work. That's always really helpful for the clinicians. And I want to thank our media team for putting all of this together for us and allowing you to be with you wherever you are. And again, I want to thank each one of you for being there for your patients, provide them solutions they're not going to find anywhere else. That makes you unique, that makes your practice unique, and that's all a part of our legacy. So thank you so much, and take care for now.
Thanks, everyone.